Podcast. I'm your host, Dr. Spencer Nadolsky, and I got with us one of our amazing clinicians, Dr. Charise Fashho. She's an OBGYN trained clinician, and she has joined us to share her expertise. And she's going to talk with us today a little bit about her journey and how she got to where she is. So welcome, Dr. Fashho.
Thank you so much.
Yeah. So traditionally, people don't think of obesity doctors as gynecologists or OBGYNs, but we've been seeing more and more as we know that obesity or adiposity or excess weight can have an effect on most organ systems. So we start seeing all sorts of different specialists kind of getting into this. So welcome. Talk about your journey a little bit.
Yes.
You went to med school and then you decided on a specialty, and then how'd you go from there?
Yeah, so I trained in the South in Louisiana and then practiced a lot in Kentucky. And as you know, the South is, we have an obesity epidemic here. And so a lot of my patients, the old thinking, my old training, how I was taught, just to have patients exercise, lose weight. Whereas, as I became more interested in obesity and helping my patients on a full spectrum, I realized that it's not just exercise and weight loss. We now know that we can use medications for treating certain diseases. And, in my beginnings of my career, I was doing a lot of outpatient clinical primary care, gynecology, and, I would talk to every patient at their annual exam about the risks of, certain cancers. We screen for cervical cancer. We talk about risks for endometrial, breast cancer, ovarian cancer. That's part of the Well Woman exam. And obesity is one of the strongest risk factors for some of these cancers. And, I'd always encourage my patients to, work on losing weight and, the risks of having certain cancers with even colon cancer with excess obesity. And so it really became a strong interest for me, not only for my patients, for my own health, as a woman after we have our babies. And, sometimes it's hard to lose the weight. And so I really wanted to learn more about it and be more comprehensive for my patients. And that's when I really got interested in obesity medicine. I took the obesity medicine board exam and
Very
got board
cool.
certified. And I'm really happy to be working for Sequence and helping patients. It is very rewarding when patients find out that I am an OBGYN. They're like, oh, well, I also have a question about this. And it's really great because I don't think patients come to the gynecologist or the obstetrician, just ready and willing to talk about weight loss. And it's something that is so important to our overall health in reducing our risk of certain cancers, even in pregnancy, having better pregnancy outcomes with being a healthy weight and, physically and mentally. And so I think it's really important for patients.
Did you learn about it in residency at all, or were they just like, yeah, obesity is a risk factor for these various obstetrical and gynecological
I think where I
cancers?
trained, where I trained and where I worked, we did see a lot of, I saw endometrial cancer in very young patients as well, that had risk factors for it with obesity. And so, it's definitely opened my eyes, but the training that we got was more of like a diagnose and treat rather than prevent. And I think now that we've reached this new wave of, prevention type medicine, and we can use GLP-1 medications, we can use obesity medication, weight loss management medications to help prevent, health issues down the road. I think that's the way that we can really do our best for our patients.
So you're also doing OB. So did they talk about like gestational diabetes and how like obviously obesity is a risk factor for that? There's obviously other hormonal factors that come with pregnancy, but that also predispose people to developing. But a risk factor is obesity because if you have underlying insulin resistance, that on top of the hormonal milieu of pregnancy, we see it.
Yeah.
But I was going to say, I mean, like, since you're the OB, yes, you're treating that patient, but you also have to deliver a baby, and that puts the babies at risk for being large for gestational age. So, I don't know how much you dealt with that. I'm sure you dealt with it all day, but
Yeah, a lot. Definitely, obesity is a risk factor for gestational diabetes, also preeclampsia. You know, a lot of
Yeah,
patients are having, higher risk pregnancies, having issues with blood pressure and advanced maternal age. All of these factors really do play a role in how we manage. I see a lot of high risk patients in my current practice because likely with obesity playing a role in how it contributes to other disorders, especially in pregnancy. And if patients can really work on that weight loss outside of pregnancy and then maintain and have healthy pregnancy outcomes, that's really a high goal of mine for my patients.
so you mentioned before the podcast you're working as a hospitalist. You have a outside clinic. Do you do?
So right now, I just do hospitalist work. So I
How
really
does that
like
work?
the I really like the inpatient, high acuity, high risk. Seeing the patients as they come into the OB emergency room. So
Okay.
coming in with complaints, but a lot of times patients don't have a doctor, and I become their doctor. We see a lot of patients without, you know,
Mm-hmm.
and or manage some of the emergencies when patients come in without the doctor's not in the house. I'm in the hospital and I can respond quickly to those emergencies. It's really like a adrenaline type. I guess I get my adrenaline rush when I'm in the hospital, and then I also
Yeah,
get to help and talk to patients in the obesity management side here at
got
Charise.
it. So that's pretty cool. With the endometrial, so most people think of like type 2 diabetes, hypertension, and these kind of metabolic things that are very easily seen with screenings of blood pressure. But you're talking about endometrial cancer and even breast cancer. I'm sure you talk about that. But like, can you quickly just go over how obesity
Yeah,
is a risk factor? Because people are like, no, no, no. There's some people like obesity is just it's it's just correlational. It's not causational. But in terms of
totally.
endometrial cancer, I think there's pretty good
Pretty good
biological
data out there. Yeah,
plausibility with
so
it. Yeah.
So the adipose or fat cells themselves, they actually contribute to that extra estrogen that patients have in their bodies, causing that lining of the uterus of the endometrium to become, you know, possibly malignant or hyperplastic, so thickened. And so really we worry when patients who are postmenopausal,
Yeah.
they don't have the normal amount of estrogen in their body, and then the fat cells themselves are giving this extra estrogen unopposed, so there's no progesterone to kind of combat that,
Hmm.
and then they end up having abnormal tissues or abnormal bleeding. Postmenopausal bleeding is the number one sign, that a patient might have some issue with
That's a
a
board
possible
question.
malignancy.
That's a
Yeah,
med school step one. So we take all these boards and like that's like step one. Somebody's postmenopausal and they're having vaginal bleeding. It's cancer until proven otherwise.
proven otherwise.
So okay, can you explain? So like normally premenopausal, you can just give a quick. It doesn't have to be a in depth biology, but the normal menstrual cycle. Usually, that what she's talking about is the proliferation of that endometrial lining. The estrogen
Yeah,
kind of builds that up,
the
and then you,
estrogen builds it up. The
yep,
progesterone helps it to cycle every month. And
yep,
so when those two hormones are out of balance, you can have issues, right? And
yeah.
so the the extra fat cells, the extra adiposity actually is giving the hormone of estrogen to the body. It can actually make the estrogen positive breast cancers potentiate, and even people who are diagnosed with cancer, it can make their cancers recur. And so really, patients that are, a lot of the newer findings, patients that are diagnosed with an early stage breast or endometrial cancer, weight loss in between can actually reduce the risk of recurrence. And so it's really important. These weight loss and taking ownership of your health is so important for future, outcomes, reducing your risk of certain cancers, reducing risk of, if you are pregnant or trying to get pregnant, healthy babies and moms. And that's really what I strive for every day.
So okay, so we have metabolic disease, and then probably these types of cancers are what we consider obesity related cancers. And so then you're the OB specialist. We have a few OBs at Sequence, but like we've talked about this before. I bet you give maybe extra guidance about the GLP-1s and stopping before trying to conceive and all that type of stuff.
Yeah. Definitely, patients that are of that reproductive age, especially females who may be considering pregnancy, not only will weight loss sometimes make patients more fertile because they don't have that extra inflammation, that extra adiposity. We tell them, you should, if your goal right now is to lose weight, we'll help you with that. And then we want you to be, off these medications for at least 2 months. I mean, I tell patients every day, we cannot study medication in pregnancy. It's kind of unethical to just give a pregnant patient medication
Mm-hmm.
and see what happens. So we can
Yeah.
only look back at the data. And, we have pretty good data on patients that accidentally get pregnant on a GLP-1 medication. It has not been shown to cause harm or risk to a fetus, but it's not worth taking that risk. If you really are trying to conceive or get pregnant on these medications, we should try to stop or wean off for at least 2 months, have it out of your system, and then work on pregnancy.
Yeah. That's great. What else? So, I mean, yeah, you have a unique perspective on obesity management. And I think it just goes to show that how, like, hey, this isn't just, it isn't about vanity. It's truly about like living a longer quality of life, a health span, as opposed to just lifespan, although cancers can be pretty serious, of course. Um, Anything else you want to share as an experience as a obstetrician gynecologist with obesity, especially background?
Yeah, I think having this option for our patients to really focus on their health and have better outcomes for themselves, for their families, as a mother. Women's health is so important in society, and we really need to uplift our women, and that's what I think this program also does.
Thanks. Um, if anybody is considering to get pregnant, obviously, listen to this podcast, share it with a friend. But I think, I don't know. I mean, is obesity a risk factor as well, premenopausal, for endometrial cancer too? I assume it's probably more postmenopausal because you don't have that progesterone component that kind of counteracts the estrogen. But
But yeah, as your weight gain in and of itself, adding that extra estrogen, that anovulatory or like the irregular cycles, it
yeah,
kind of does before menopause. Like I said, I've seen endometrial cancer in very young patients, unfortunately, with extra, like very high BMIs. And I think that is the number one risk factor for that
yeah.
setting.
So if you are, one, I know we don't like to do scare tactics and scaring people to try to lose weight, because that's just, it doesn't, it kind of works in certain cases to some people, but like on a general population, it actually can scare people from even going to the doctor. But if this is something that like may say, you know what, uh, you know, I know somebody or maybe a family member who had issues with a gynecological cancer, maybe something to share with some family and friends, this podcast, and make sure that you give us a review on our YouTube page and all that different stuff. So thank you so much for coming on. We love having you as a
Thank you.
clinician. You've been very valuable, and we'll continue to tap into your expertise, as
Thank
I did
you.
family medicine. So I got some. It was nice to get a broad sense of it, but OB was like I always thought I was going to pull the heads. Like I was like, I just felt like it
You
was,
probably caught a baby or two.
I did. I had to catch a bunch, but it was always like, oh, it was not my favorite thing to do. So I appreciate you. We need people like you out there helping out. Don't put me in there. So thank you so much for coming on the podcast.
Thank you.